Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. Army is going to hold a Mahapanchayat on 25th March at the Indira Gandhi Stadium, Delhi to oppose the National Medical Commission Bill. Various issues like the NMC Bill, Clinical Establishments Act and the rising violence against the doctors will be placed before the Mahapanchayat. The Mahapanchayat would announce further course of action after detailed discussion. The Supreme Court has legally sanctioned passive euthanasia in a landmark verdict allowing living will by patients on withdrawal medical support if they slip into irreversible coma. By living will, the person can choose not to remain in a vegetation state. Thus, by allowing passive euthanasia, the Supreme Court has recognized the individual's right to live with dignity. The Supreme Court has stayed the order of Delhi High Court setting aside the mandatory 6-month training needed for performing ultrasonography. The decision comes after the Indian Radiological and Imaging Association had challenged the High Court's decision on the issue. The court has reserved its interim order on the issue whether some specialist doctors can be allowed to continue doing ultrasonography. Doctors of AIIMS Bhubaneswar have demanded tight security in hospital premises so that they work efficiently without any threat. This demand was raised after a doctor was assaulted by a dead patient's relative even after attending the patient on priority. City-based researchers have come up with a made-in-India dialysis machine with reduced cost. This machine started undergoing clinical trial from 2nd March. This machine, being cloud-enabled, can be connected to a mobile app and its functioning and patient response can be assessed from anywhere. Students from Arizona State University have developed DomiCare, an at-home pap smear test to reduce anxiety associated with the procedure. It also helps women control their health without interfering with work and social life. The results can be assessed after the test with conversation with doctors through the DomiCare app. The Union Labour Ministry has decided to open one super speciality hospital in each state under the Employee State Insurance Corporation. The government is also planning to expand Employee State Insurance Scheme to ensure healthcare facilities for 10 crore workers. The Draft Medical Termination of Pregnancy Bill 2016 has proposed that no upper gestation limit would apply for termination of pregnancies diagnosed with substantial fetal abnormalities. The draft also proposes to increase the upper gestation limit for termination of pregnancy for rape survivors from 20 weeks to 24 weeks. Recently, the celebrated physicist Professor Stephen Hawking passed away after a lifelong battle with amyotrophic lateral sclerosis. The onset of this disorder is subtle and the symptoms are often overlooked. Therefore, it is necessary to spread awareness about such disorders. One such attempt was made by Pete Freites through the unique initiative of Ice Bucket Challenge, which resulted in awareness of this disorder and encouraged millions of donations for research. We, as a community of doctors, request you to share your research ideas, new treatment options with your peers to battle such disorders. 24th of March is celebrated as World TB Day worldwide. This year, government has implemented a national strategic plan with funding of over rupees 12,000 crores and also proposed an incentive of rupees 500 per patient per month for the nutritional support. This World TB Day, share your ideas with your peers for effective TB eradication. These were the latest happenings in the medical field brought to you by Docplexus, India's largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!